My name is Erika Roshanravan. I'm a family physician and the Associate Medical Director at the Davis Community Clinic, which is part of CommuniCare. CommuniCare has been at the forefront of the movement to raise awareness about adverse childhood experiences, or ACEs, and toxic stress. 2 years ago, California started allocating money for clinics to start screening for ACEs and educating our healthcare workforce and the public about ACEs and toxic stress and how they impact our health. ACEs screenings can help us better understand our trauma history, and this in turn may help us reduce ACEs in our children and lessen the effects of ACEs when they do occur. At CommuniCare, we hired an ACEs navigator for each of our clinics and trained them to educate patients about ACEs and toxic stress, how to conduct ACEs screenings, and how to connect patients to resources regardless of whether or not they chose to participate in the ACEs screening and regardless of what their score is.
So adverse childhood experiences can include instability within your household or between caregivers, absence of positive social relationships, lack of psychological or physical, emotional safety, and so on. And these are all things that would have impacted you before the age of 18. And what could happen is if we don't have a safety or a social supports when we're children and we experience these things, they could create toxic stress in our system. And having lifelong toxic stress can impact your cardiovascular system, your respiratory system, and your mental health. So what we do is we go through an assessment and we talk about how that might be impacting you here today. Then these are things and resources that we can support with accessing. Does it sound like something you might want to participate in today?
Sure. Yeah.
Okay, great. So this is the assessment here. And you can either respond and mark it, or you can just keep that information in your head. You don't have to share it with me at all if you don't feel comfortable.
Okay.
All right, the provider's here ready to see you. So I'll go out and let them know that we're done. And then they'll be in, and as you leave, you can stop by my desk and we can schedule your next follow-up visit. Does that sound okay?
Yeah.
Okay, great.
Sounds good. Thank you so much.
All right, thank you. Very nice meeting you.
You too.
After they meet with the patients, they connect with the patient's provider, ideally their long-term primary care provider, to let us know what the outcome was. That step is key, as the goal really is for these conversations about trauma and toxic stress to inform our long-term relationship with our patient, to make space for these conversations, and to show the patient that this is a safe place to talk about this if they desire to do so. What is really important to us is that all our staff gets trained in what we call trauma-informed care. Trauma-informed is defined as an approach to care that promotes a culture of safety and empowerment to foster recovery and healing through safe and collaborative relationships. It really means to be informed about trauma. This can be summarized in the 4 R's. The first is realize how common trauma is. The second, recognize the signs and symptoms of trauma. The third, respond by creating a system that fully integrates all knowledge about trauma in policies and procedures and our everyday practices and how we interact with our patients and each other. And the fourth is to resist re-traumatization. A really important concept to understand trauma-informed care is the principle of universal precautions. Because trauma is so common, we need to assume a history of trauma in everyone and act accordingly. This means using trauma-informed practices for everyone. For example, before we might have wondered what is wrong with this person, and now we ask, what happened to this person? ACEs scores are not a diagnosis, and ACEs are not a destiny. In contrast to screening tools used for depression and anxiety, the ACEs screening is not a diagnostic tool. Rather, it's a powerful new way we have to open up conversations with our patients about how a trauma history may impact their mental and physical health, and to connect them to resources as needed. Talking about ACEs and what we can do about them can help us all work together to create a healthier future for ourselves and our children.